This slide discussed drugs used to treat diabetes by Professor Saminat and Kairohanam. This slide discusses the drugs used to treat diabetes in the flashcard method. This flashcard explains through serial number, drug classification, and drug's name under the classification and mechanism. 3 categories of drugs are on the diabetes drug list. Category A, insulin secretagogues, enhance insulin secretion, classification number 1, 2, 3, 4, come under this category of diabetes drug. Category B, overcome insulin resistance, classification number 5, 6, come under this category of diabetes drug. Category C, miscellaneous antidiabetic drugs, classification number 7, 8, 910, come under this category of diabetes drugs. Number 1. Name of the classification, sulfonylureas, drugs name under this classification, first generation, 1. Tolbutamide, second generation, 1. Glibenclamide, 2. Glipizide, 3. Gliclazide, 4. Glympiride, 5. Glyburide. Mechanism of sulfonylureas, directly stimulate the release of insulin from pancreatic beta cells. The detailed mechanism: these drugs bind to sulfonylurea receptors in the beta cell membrane. The receptor senses A, T, P and A, D, P levels in response by closing A, T, P sensitive potassium channels. Sulfonylureas block potassium 1 channels in beta cells, leading to depolarization, increased calcium entry via voltage-dependent calcium channels, and increased insulin secretion. Sulfonylureas may reduce hepatic glucose production and increase peripheral insulin sensitivity. Sulfonylureas decrease serum glucagon, which opposes the action of insulin. These agents increase sensitivity to insulin, perhaps by increasing the number of insulin receptors. Number 2. Name of the classification, glinids, drugs name under this classification, 1. Natglinide, 2. Repaglinide. Mechanism of glinids: stimulate insulin secretion. The detailed mechanism: this mechanism, like sulfonylureas with some overlap in binding sites. Binding to sulfonylurea receptor 1, A, closure of A, T, P-dependent potassium channels. A leads to depolarization, A increase the insulin release. Number 3. Name of the classification, incretin mimetics, drugs name under this classification, 1. Exenatide, 2. Liraglutide. Mechanism of incretin mimetics: increases glucose-dependent insulin release. The detailed mechanism: glucagon-like peptide 1 receptor agonists, GLP-1, enhanced insulin release and reduced glucagon release, decreases secretion of glucagon, slows gastric emptying, increases satiety. Number 4. Name of the classification, dipeptidyl peptidase 4, inhibitors. Drugs name under this classification, 1. Sitagliptin, 2. Vildagliptin, 3. Saxagliptin, 4. Elagliptin, 5. Linagliptin. Mechanism of dipeptidyl peptidase 4, inhibitors: increases glucose-dependent insulin release, decreases secretion of glucagon. The detailed mechanism: dipeptidyl peptidase 4 is the proteolysis of the incretins, including GLP-1 and glucose-dependent insulinotropic peptides. Selective dipeptidyl peptidase 4, inhibitor which potentiates the action of GLP-1. The increased level of GLP-1, enhanced insulin release and reduced glucagon release. DPP-4 inhibitors may also improve beta cell function. Number 5. Name of the classification, biguanide. Drugs name under this classification, 1. Metformin. Mechanism of biguanide: decreases hepatic production of glucose. The detailed mechanism: suppresses hepatic gluconeogenesis and glucose output from the liver, enhances insulin-mediated glucose uptake and disposal in skeletal muscle and fat, interferes with mitochondrial respiratory chain and promotes peripheral glucose utilization through anaerobic glycolysis. Number 6. Name of the classification: thiazolidinediones. Drugs name under this classification: 1. Pioglitazone, 2. Rosiglitazone. Mechanism of thiazolidinediones: increasing tissue sensitivity to insulin. The detailed mechanism: binds to the intracellular nuclear receptor, peroxysuproliferator activated receptor gamma, in muscle, fat, and liver to decrease insulin resistance, decrease glucose output from the liver, increase glucose uptake in muscle, decrease fatty acid release in adipose tissue. Number 7. Name of the classification: IL-PHA glucosidase inhibitors. Drug name under this classification: 1. Acarbose, 2. Miglatol, 3. Voclebos. Mechanism of IL-PHA glucosidase inhibitors: decreases glucose absorption. They act as competitive, reversible inhibitors of pancreatic amylase and intestinal glucosidase enzymes. Inhibition of alpha-glucosidase prolongs digestion of carbohydrates and reduces peak plasma glucose levels. Number 8. Name of the classification: amylin analog. Drug name under this classification: 1. Pramlintide. Mechanism of myelin analog: slowing gastric emptying, suppressing inappropriate post-meal glucagon secretion, and increasing satiety. Amylin, also called A-isotamyloid polypeptide, is produced by pancreatic beta cells and acts in the brain to reduce glucagon secretion from I circumflex plus-minus cells, delay gastric emptying, retard glucose absorption, and promote satiety. Number 9. Name of the classification: dopamine D2 receptor agonist. Drug name under this classification: 1. Bromocriptine. Mechanism of dopamine D2 receptor agonist: act on the hypothalamic dopaminergic control of the circadian rhythm of hormone, GH, prolactin, A, C, T, H, etc., release and reset it to reduce insulin resistance. Number 10. Name of the classification: S, G, L, T2 inhibitor. Drug name under this classification: 1. Canagliflozin, 2. Dapagliflozin, 3. Empagliflozin, 4. Ertagliflozin. Mechanism of dopamine D2 receptor agonist: increases urinary glucose excretion and lower blood glucose. Sodium glucose cotransporter 2, S, G, L, T2, is responsible for reabsorbing filtered glucose in the tubular lumen of the kidney. By inhibiting S, G, L, T2, these agents decrease reabsorption of glucose, increase urinary glucose excretion, and lower blood glucose. Thank you for your attention. Further information, kindly contact profsamiacademy@gmail.com. Disclaimer: this channel does not promote or encourage any illegal activities. All contents provided by this channel are meant for educational purposes only.